Hello and welcome to the Mum Fit London YouTube channel. So today I thought I would do a little video on pelvic girdle pain, which is very common during pregnancy, and just 5 simple exercises that can basically help reduce that pain. And it's basically all because your bum obviously gets really heavy, puts a lot of pressure on around your pelvic area, and as your glutes get weaker, there's just a lot of pain. But there are ways that we can reduce that discomfort. Okay, so I'm going to show you 5 simple exercises that you can do on a daily basis, which will just really help reduce and ease that pain. Okay, so all you need is a resistance band. Okay, and what we're going to do is, if you are pregnant obviously, sit down and place that band around your knees. Okay, so what we're going to be doing, gently coming up, is we're going to have your feet hip width apart, and we're going to be doing a squat to sit using the band, and basically we're going to be squeezing the glutes at the top to really strengthen the glutes, because when you're pregnant, all your gravity, your centre of gravity comes forward, so you want to keep and try and keep the back of your body, your posterior chain, as strong as possible. Okay, so each exercise, aim to do about 10 to 12 times, and repeat it about 2 to 3 sets, okay, the whole circuit. So this is the first exercise. So we're going to be squatting down and sitting up and squeezing those glutes at the top. So down and coming up. So if you make sure you've got a chair behind you, thrust the hips at the top, nice and gently. Inhale down and exhale. Squeeze the glutes at the top, thrust the hips forward, nice and gently. Perfect, really good. Coming down, do 6 more, up, 5, perfect, 4, 3, 2, and 1. Perfect, really good. So the most important thing here is when you come up, you're squeezing the glutes at the top, you're thrusting the hips forward, to really strengthen the glutes and to also support the pelvis and the hip flexors at the same time. Right, so the next one we're going to be doing is Romanian deadlifts with the band. So the feet once again be shoulder width apart, and we're going to be having our hands on our hips, and we're going to be leaning forward so we feel a slight tension down the hamstrings at the back of your legs, and coming up. So down, keep that tummy nice and tight, and thrust the hips to the top from the side. We're going forward and coming up, thrust the hips forward, squeeze the glutes. So coming down and up. So both my feet are pointing forward to keep my hips pointing forward. There's no turning at any time. Thrust the hips at the top. 6 more. Exhale at the top. Inhale down. And exhale. 4 more. Push those hips back. Thrust them forward. 3, really good, 2, and 1 more. Perfect. So the most important thing here is, once again, we're squeezing the glutes at the top, thrusting the hips forward. We're keeping a nice straight back, looking forward. See everything straight, looking forward, and I'm coming up. Okay, so once again, that is strengthening the whole of the back of our legs and our glutes, which is very important as the bump gets bigger and shifts everything forward. We want to try and keep that pain back. Right. Next we're doing back elevated hip thrust. So if you sit down gently, shuffle yourself forward and hang your back on the chair or sofa, hands on your head, and we're lowering the hips down and once again squeezing up. So inhale down, exhale up. So just the top of your back is on the sofa, and we're coming down, and once again we're thrusting the hips up, squeezing the glutes at the top. Exhale up. 8 more. 8, 7, our feet are hip width apart as are our knees. 6, 5, 4, 3, 2, and 1. Very gently making your way back up safely onto a seated position, and we will get standing. Right, the next final one is we're coming down onto the floor very gently and doing a lying side clam. So lying down, this is our fourth exercise. So feet together, knees together, get into a nice comfortable position with your bump, and open the legs and closing the legs. So opening, so strengthening the inside of our legs and also the outside of our glutes as well. So we're going to do 10 to 12 on one side and 10 to 12 on the other. 3, 4, 5, 6, 7, 8, 9, 10, 2 more, and 1 more, and rest. So you should really feel it getting nice and strong on the inside of your thigh and also in your glute. Now swiveling around to the other side. So lying down, getting yourself nice and comfy, knees together, and let's do this again. So this hand's just resting in front of you. Keeping those feet together. And make sure your hips are stacked up on top of each other, they're not opening. You want to try and keep everything about these exercises is keeping the hips in line with each other. 4, 5, 6, nice and slow and controlled. 7, 8, 9, 10, 11, 1 more, and 12. So no, I'm not openly rotating my hips, I'm keeping them stacked on top of each other and just opening the legs and feeling tension inside of my leg and the outside of my glute. Right, final exercise. Gently come up to standing, and we're sitting down, so sit at the edge of your seat or sofa, feet hip width apart, sitting up nice and tall, so nice and comfortable, holding on, opening the legs and bringing them together. Opening. So all these exercises are great for pelvic girdle pain. They're also fantastic exercises to prepare you for labour as well, because it's strengthening this whole area, which is where you give birth from. Thought I'd give you that helpful tip. Okay, opening and together. So here we're strengthening the inside of the legs. And you should feel it in the glutes as well. 9, 10, sitting nice and tall. 11, 1 more, and 12, and rest it there. Take the band off. And that concludes our pelvic girdle pain little tutorial there. So they're just 5 simple exercises that you can do. Okay, so I recommend you do them once or twice a day, and definitely do it every day. It's certainly not harmful at all. You're just strengthening your hip flexors, your pelvic floor, your glutes, your inside of your legs, because the pain can come down into your thighs. So basically you want to try and keep them activated, keep them awake, because if you are in pain, it's so easy just to sit and to lie. You want to try and strengthen it as much as you can, because it will just help relieve some of that pain. Any other questions, obviously go to your midwife or your healthcare professional. Drop me a DM and I can help hopefully guide you in the right direction. Otherwise, thank you so much for joining me today, and I will see you next time.